So this may be one of the cases where the dose makes the poison. And if it is a very frequent habit, certainly daily or more than once a day would be very detrimental from a hormonal component, not even taking into account the neural wiring.
You mentioned porn and masturbation. This topic has come up a bunch of times on this podcast and on other podcasts I've gone on because of the relationship between dopamine, sexual motivation, and sexual behavior. And I've been of the pretty strong stance that while I'm not judging porn or masturbation, it can create a brain wiring situation where males in particular essentially teach their brain to be aroused by watching other people have sex as opposed to being the first person actor in sexual interactions. So in that sense, that's more about the brain wiring and neuroplasticity and dopamine. But what are your thoughts on porn and masturbation as they relate to hormones? Whether or not masturbation increases or decreases testosterone in males, certainly it will decrease motivation to go find sexual partners. We know this. Yes. And there are more and more data on this all the time. In terms of the effects of pornography and masturbation, we're talking about porn and masturbation to the point of ejaculation, right? Because my understanding is that the ejaculation and orgasm associated with it cause an increase in prolactin, which blunts libido for some period of time. The duration of that will vary from person to person and circumstance to circumstance. But basically all of this points to the fact that porn and masturbation can really limit libido in the real world. And to me, pornography and the screen is not the real world. Though screens exist in the real world doesn't exist in the screen.
That's an accurate statement. And prolactin does have a significant acute increase after ejaculation. It does to some degree after orgasm as well, but prolactin acts on the pituitary to inhibit the release of the hormones LH and FSH, of which LH can increase testosterone. So this may be one of the cases where the dose makes the poison. And if it is a very frequent habit, certainly daily or more than once a day would be very detrimental from a hormonal component, not even taking into account the neural wiring.
Listen, I think it's terrific that you've actually defined frequency, because this is the problem. On the internet or even in the doctor's office, you'll see descriptions about pornography being dangerous for certain things or detrimental to hormones. People say frequent, but what's frequent? So you were saying daily or multiple times per day would be potentially detrimental to the hormone profile of a male of essentially any age.
And that's just for masturbation. With porn use as well, it would likely be worse.
Why is that? Just the sort of dopaminergic drive of the stimulus, just the really intense visual stimulus?
Dopamine sensitivity. I think that using the analogy of a dopamine wave pool, it would deepen the pool but not increase your supply of dopamine.
Maybe you could describe the dopamine wave pool, because I think it's such a powerful way of thinking about dopamine and what dopamine does.
The dopamine wave pool describes the natural variation of ups and downs in your dopamine or your motivation. And in the wave pool, depending on how high the peak is, you often have a deeper trough. So you do not want too high of a peak. In addition, if your peak is very, very high, for example, when you're using many substances like cocaine or like amphetamines, your dopamine can go so high, you lose almost all the water from the wave pool. And then when you crash from that, not only is the trough low, you have less dopamine in the pool to begin with. The dopamine receptor is extremely sensitive, as is the GABA receptor, which is an inhibitory receptor, whereas dopamine is technically a stimulant more related to adrenaline and noradrenaline. The depth of the pool can change very quick. So you want to have that happy medium where you're fairly near the top, but you're not so near the top that the depth of the pool is going to go down.
So if I interpret that in the context of this discussion about libido, sex, porn, and masturbation, if somebody has a very intense sexual experience, here we're not necessarily talking about an intense orgasm. We're talking about just, a lot of intense visual. So a lot of intense imagery or auditory input or both. That is going to lead to a situation where dopamine is going to be depleted afterwards.
Correct.
A guest on this podcast before, my colleague at Stanford, Dr. Anna Lemke, who's an expert in addiction, talked a bit about this, the sort of seesawing. Here we're talking about a wave and a crashing out of the water from the wave pool there. It was a seesawing from pleasure and pain. There's going to be a longer and deeper period of lack of pleasure following that. And I think a lot of people think, oh, well, that's great. They want the intense experience. But if that intense experience is coming from pornography and masturbation, or I suppose coming from, high adrenaline activities like life-risking parkour hanging off the side of a building, inevitably is going to lead to depressive episodes, low libido episodes that follow. Is that right?
Correct. In a similar physiologic way to withdrawal from stimulants like amphetamines.
Now, is sex with a partner different? Because there are many people who are chasing more and more intense experiences with a partner as opposed to through pornography and masturbation.
This is also a case where the dose makes the poison. If they have one preference that for both of them is a positive experience, then that is likely okay. You're not going to be able to maintain dopamine over a certain threshold for a long period of time. So there very well may be a crash from that experience as well. And the crash may be different in one partner than the other.
Interesting. So I'll draw an analogy to food. It would be like, you don't have to serve the banquet meal 7 nights of the week, maybe just 2. Is that right? And there are other delicious foods out there.
Yes.
Can we use that analogy?
That is very reasonable.
Okay, not trying to be PG-13, just trying to parsimony, Occam's razor, the ability to describe a lot of things in a few words. I'd like to return to the key things that men should do to optimize their hormones. So we talked about getting some movement, getting some sunlight, getting quality social connection one way or the other, avoid excessively frequent masturbation and viewing pornography. And for some people, 0 might be the optimal number. And I keep coming back to this. For most people. Interesting. I hear so often from males of all ages about their addiction to it, their affliction by it. It's really a serious issue. And that's one of the reasons why I'm grateful that you're willing to talk about this and your clinical experience with these patients.